Good evening, my name is Laura, and I'm doing my final project presentation on anorexia nervosa for Anatomy and Physiology 202. Anorexia nervosa is an anxiety disorder where sufferers become obsessed with body image and weight loss. It has mental, physical, and emotional effects that can present as unusual eating habits or starvation, and severe nutrient depletion causes significant weight loss to occur. Feelings of stress, anxiety, and low self-esteem are very common in anorexia nervosa and often may be the leading cause of it. Sufferers use their eating habits as a way to control what happens in their lives. It presents as extreme thinness or emaciation, which is visible cheekbones, gaunt face, sunken cheeks, or cardoanemia, which is yellowing of the skin. Hair loss is also a sign of the disease because of the inadequate nutrient supplementation, and growth of lanugo as well, which is thin hair all over the body, colorless, and the purpose of it is to keep the body warm because of the absence of adipose tissue, which usually keeps the body warm. Adipose tissue is just fat, and usually that's what insulates the body, but the absence of that would cause the person to be too cold. So the relentless pursuit of thinness and unwillingness to maintain a healthy weight is also a way that the disease presents physically and psychologically. The patients often refuse to acknowledge that they have a problem or that their body weight is getting dangerously low. They possess severe anxiety of weight gain as well as distorted self-image. Obsession with food and calories is also a very common indicator of the disease, and social isolation as well. People or sufferers of this disease may close themselves in because they don't want people to know that they possess this disease. Mood swings, irritability, depression, like think of like when you get hangry, you know, like hungry, angry. It's basically like living in a constant state of hangriness. Cognitive impairment, brain atrophy is another side effect of this disease. So as the brain atrophies and like wears down because of the inadequate nutrients, inadequate glucose, which is sugar, you lose your ability to like think as well, and basically like cognitive function decreases. And then thoughts of self-harm or suicide are also common. And it is very important that this disease is anxiety-based. It's as much a mental condition as it is a physical condition. Both aspects are equally important to this disease. As I mentioned a little bit previously, signs and symptoms of this disease include irritability, but also dizziness and fainting and feeling tired and fatigued, which is all a result of the malnutrition. Poor concentration and focus, again, that goes hand in hand with the impaired brain function, because there's not enough glucose in the body, which is sugar, which is what brain runs on. There's not enough sugar within the body for the brain to function properly. Feeling cold constantly, like I also talked about, the absence of adipose tissue, which is just fat, causes the growth of lanugo all over the body, which is colorless hair. But you know, that's not enough to keep the body warm, so feelings of or being constantly cold is very common with anorexia. Loss of muscle mass. The body tends to eat away at fat first, but then once it runs out of fat, it starts targeting muscle. So loss of muscle is also observed along with loss of fat. Eroded teeth and calloused knuckles can be a sign from the induced vomiting. That just depends on how each person presents. If one person or if the patient, you know, causes themselves to vomit a lot, they throw back up the food they just ate. The callous knuckles and the eroded teeth might be a sign of that, because the stomach acid, as it travels back up, it breaks down and eats away at the teeth. And the callous knuckles, you can probably figure it out from self-inducing vomiting. Interrupted or absent menstruation is also a sign and symptom, or it's also a sign of the disease. Again, that's just inadequate nutrients. Poor wound healing and frequent illness, also inadequate nutrients. Food really just fuels everything within our bodies, and taking that away has an effect on every body system. The swelling of the extremities, edema, the tissues fill with fluid, and dehydration as well, because we do get some of our hydration from food. And bradycardia, which is slow heartbeat, or arrhythmia, which is irregular heartbeat, is also observed with anorexia nervosa. Shortness of breath, bloating and abdominal pain, and change in eating habits. Of course, withdrawal from friends and social events. People do tend to want to hide this illness because, as I mentioned earlier, they often deny that they do have this illness at all. So they don't want to be like maybe accused of it, or someone points out their weight loss or something. Getting into risk factors, there's plenty. It can be genetic, it can be influenced by activities, it can be by dieting. So let's start with activities. Modeling, ballet, ice skating, gymnastics, swimming, bodybuilding, anything that really causes the person to be self-conscious or self-aware of their body can result in a lot of time like spent in front of the mirror and self-critiquing and all that, which could turn into, oh, maybe I'm too fat, maybe I'm too big, blah, 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 going into anorexia nervosa or other eating disorders. Peer pressure and bullying is also a huge thing, because humans are social creatures. We're very prone to what other people think of us, and we're very affected by that. So really, peer pressure and bullying can have a huge effect on a person's self-esteem. Excessive dieting, which comes with, like maybe important life events, like say someone's getting married, right? They might be labeled with the term bridorexia because, you've heard of like brides trying to lose weight to fit into their wedding dresses. That'd be bridorexia. Or pregorexia, women trying to control how much weight they gain during a pregnancy. And drunkorexia, which is actually used to achieve quicker intoxication and cheaper, because if you don't have food in your body, you get drunk faster. Cultural and familial pressures, environmental factors are huge in this as well. It just really depends on the type of people that surround you, which is why support is also a very important factor, it very plays into this. And then some things that are just beyond the control of the patient, like gender. Women are they're much more likely to develop anorexia than men are. That's not to say that men aren't likely to develop it, but women do have a higher risk. And teenage women, especially teenage girls or preteen girls, genetics are huge in this also. They contribute between 50 to 80% of the risk. And stress and trauma, like I mentioned earlier, it can be a way for people to control how other people perceive them, and controlling eating habits is a way that really a lot of these eating disorders start. Now, to test for this disease, there's several ways to do it, and several factors that go into it. A physical exam, lab tests, psychological evaluations, and then a few other tests are all used, because you can't really rush the diagnostic process. You don't want to misdiagnose someone. So a physical exam would be really just going to the doctor, getting a physical, checking out body weight, if it is normal for the age, height, and gender. If it's not normal, that means if a person suffers with anorexia, their weight falls below 85% of what's considered normal for their group. Lab tests like a complete blood count, measuring or counting all the types of cells in the blood, and urine tests, which check for electrolytes and balances within the body of like chemicals and hormones and all that. They would explain the underlying cause of a patient's weight loss. And then electrolytes in urine tests are used to check for acid-base balance within the body, just to make sure all the digestive organs are working properly. Some digestive organs contain acidic factors and others contain alkaline factors, and basically you need both of those to balance out in order for everything to be functioning properly. A psychological evaluation is also necessary with this disease because, like I mentioned earlier, anorexia is an anxiety-based disease. So a psychological evaluation is crucial to determining that what the patient really needs is treatment for this, and this is what they're actually suffering from. So that would just be done through questionnaires and discussions with the doctor concerning like eating patterns and behavioral patterns and all that. And then some miscellaneous tests would be like x-rays to check for bone density, because anorexia eats away at all your organ systems. So bones would have a decreased mass with anorexia. Electrocardiograms test they look at the heartbeat, if everything's beating normally, and sufferers of anorexia have a slower heartbeat, so EKGs are ran. And then scannings of heart and lungs are also done to check for if everything's functioning properly, if everything's sized the way it's supposed to be, because if one side of the heart is bigger, that could mean that that side of the heart is working harder, which could mean that there's an underlying problem, anorexia. Complications of this disease, there's very many. Here I only mentioned like the most really like crucial ones, but like I mentioned before, it does affect every single body system. Starting off with cardiovascular, it can present with low blood pressure. The heart valves can be functioning improperly. The heart, the fluid within the heart could be contained within the lining of the heart, which is also very dangerous. Dermatologically, it presents with brittle nails, hair loss, and again, like I mentioned, yellowing of the skin, and then that growth of that fuzzy, like fine hair all over the body, as well as dry patches all over the skin. Endocrine, it would affect the hormone release. So it really just messes with every system in your body, because hormones do control everything. They signal to a lot of body systems and organs, and really every body system and organ. So affecting the endocrine system really does indirectly affect everything else. The gastrointestinal system can be affected. The stomach can actually become paralyzed. The stomach can actually become paralyzed and not really continue to digest food properly. And constipation, because some patients do take like laxatives to really help them clear out their bowels of all the food they just ate. So constipation can be a side effect of those laxatives. And then refeeding syndrome, that's when patients, we try to treat them and their body just doesn't accept the food. They face several problems because of that. Hematologically, they can face cytopenias, which is abnormal numbers of cells within the blood, and bone marrow aplasia, which is actually very dangerous, because that's the inability of the bone marrow, like the inner structure of the bones, to make new blood cells, which is very dangerous because blood cells don't really live that long. So we constantly need new blood cells to be made. Neurologically, brain atrophy can occur, and you can see in that picture also how that on the top is normal brain function, and that over there is an anorexic brain function. Like I mentioned before, the inadequate supply of glucose or sugar eats away at the brain, and it really just decreases brain function. And then obsteric, that's if a woman was suffering with this disease, she would have complications. She'd have problems in getting pregnant, and then after giving birth as well, she wouldn't have her period anymore. And the most severe complication of this disease would be death, of course. And this is really just a picture to show you how anorexia affects every body system. It goes more into detail. It talks about how it affects the brain, the nerves, the hair, the heart, blood, muscles, bones, and joints, kidneys, bodily fluids, intestines, hormones, and skin. As you can see, that's nearly everything within the body. But it does expand to more than this. Differential diagnoses, things anorexia can be confused for, are like bulimia nervosa. Bulimia nervosa is an anxiety-induced eating disorder as well, similar to anorexia in its nature. But where it differs is that bulimics like to clear their body of the food they just ate. They go through a cycle of binging and purging. Binging is like where they overeat, and then purging, they just clear that right out. So whether that be through induced vomiting, like they force themselves to throw up, or they'll use like laxatives to make themselves like go to the bathroom and like poop all that out that they just ate, or excessive exercise. That can also be a factor that indicates bulimia. Achalasia can also be confused with anorexia, but achalasia differs in that it's not voluntary, whereas anorexia is. Anorexia is a voluntary restriction of caloric intake, and very severe. But achalasia is the misfunction of the lower esophageal sphincter. So in your digestive system, you have your mouth, you have the tube that it goes down once you swallow your food, the esophagus, and the esophagus connects to your stomach. So there's a like plug there basically, but it's controlled by a muscle. And when that muscle doesn't work properly, it doesn't close to keep that food down, the food will come right back up. And that's what regurgitation is. The food will be regurgitated, and basically it presents with heartburn, dysphagia, and chest pain. And then body dysmorphic disorder really encompasses how anorexics will focus very intently on their weight, and they will try to control it and be very like obsessive about it. Body dysmorphic disorder is essentially similar to that, but it doesn't mention like the like acting upon that insecurity in a severe way like anorexia would. Treatment for anorexia, there's several things that can be done. Most like commonly or most importantly is therapy and having a good support system. The hardest part of it, hands down, is getting the patient to even acknowledge that they have this disease. A lot of times they won't even like recognize that they do have anorexia and they do need to get help, like I mentioned earlier. So getting the patient to recognize the disease is the most difficult part, but after that, therapy and hospitalization at minimum for 6 hours per day every week is required. Patients must be monitored for signs of refeeding syndrome, and electrolyte balance is also tracked. Pharmacotherapy, so the administration of drugs and medicines, is not really like that common for anorexia, but olanzapine can be given to promote weight gain. Side effects can range from mild to severe with this drug, so they can range from like dizziness and breast enlargement or discharge to decreased sexual ability, missed menstrual periods, seizures, stiff muscles, or again, slow heartbeat, or quicker heartbeat. And then prognosis, so like the outlook for this patient. In 75% of patients, the patients can make a full recovery within they can make a recovery within 5 years from treatment, and immediate positive effects are observable, including positive weight gain and maintenance. Anorexia nervosa does unfortunately hold the top spot for highest mortality rate among eating and mental disorders, with a whopping 25%. Medical complications, substance abuse, and suicide are contributing factors of this disease. And then relapse is common really in like older sufferers of the disease, those who maintain a lower body fat percentage even after getting out. And then a full recovery is really impossible with this because it does have detrimental effects to the body. Osteoporosis, which is a breakdown of bones, heart problems, liver damage, and stomach issues continue to persist long after the disease is gone. And then, as I mentioned earlier, the brain damage, it really just doesn't go away just like that. It can be rebuilt, regenerated to some extent, but really it doesn't just go away like that. So anorexia does have very long lasting effects. And these are my resources. Thank you for listening.